Hi, everybody. My name is Kayla Osberg, and I am a Dietetic Intern at Augusta University. Today, I'm excited to be interviewing Lizzie Keen, an Inpatient Dietitian at Doctor's Hospital. So with that being said, I'm going to turn it over to Lizzie to explain the role of an Inpatient Dietitian.
Hey everyone. So an inpatient dietitian or clinical dietitian essentially works in an acute care setting. So we see patients that are admitted to the hospital. So our job responsibilities include, but are definitely not limited to, assessing patients for nutrition risk, diagnosing severity of malnutrition, performing nutrition-focused physical exams, managing tube feeds and TPN, providing nutrition education for chronic and or new onset diseases. We see a very wide variety of patients and diseases on a daily basis, and that's going to vary even more so depending on what kind of hospital you work at and what kind of specialties and services they provide. So, for example, Doctor's Hospital, where I work, is the largest burn center in the United States. So we see a lot of burn and wound patients. When assessing a patient, we review their history and physical, their labs, their meds, their interdisciplinary team notes, visit the patient to elicit more information regarding their nutrition-related history. And then obviously we're going to chart our plan of care after that. We also do in-services for doctors, nurses, food and nutrition staff. We give lectures on various nutrition topics as requested, create informational handouts, assess patient and cafeteria menus, participate in patient satisfaction measures, and then various day-to-day paperwork stuff. So honestly, no 2 days are alike, which is why I really enjoy it. You never know what the day is going to bring, and there's really never a dull moment.
That's awesome. It shows that dietitians are part of the medical team and have such a large role. But you mentioned a lot of things that you do. So do you want to expand upon some of the specific roles you have as an inpatient dietitian?
Sure, yeah, absolutely. So I am a critical care dietitian. I predominantly work in the ICU, which in my case is a medical ICU and a trauma ICU. But actually right now it's more of a COVID ICU. So the vast majority of my job, I would say, consists of working up tube feed orders for ventilator patients. But I also participate in daily interdisciplinary team rounds that includes the doctors, physical therapy, pharmacy, myself, nursing, staff, the PAs, everybody. We talk together about the patients as we go around the unit. Other things I often do frequently are collaborate with pharmacy on TPN orders, malnutrition assessments, and nutrition-focused physical exams, diet educations as needed. For example, like diabetes, cardiac oncology, different GI disorders, teaching patients how to use their new feeding tubes before they discharge, stuff like that. I also cover our small pediatric floor and PICU. Most of those are burn or wound or trauma patients, but we do get some variety like respiratory, GI, failure to thrive, or Billy babies, etc. So I also see floor patients when the patient load is really high. I would say I predominantly cover rehab and ortho, but we also have general surgery, dialysis, PCU, which is an ICU step down. We have a large burn unit and a burn step down, a general burn and wound floor, and mother baby, and a small NICU, which we rarely see patients in NICU. But so on any given day, I could cover any of those floors, and we'll see a lot of those patients on the weekends or holidays because as a hospital never closes, we get to see patients on the weekends and holidays as well.
Yeah, well, it really feels that your day is never going to be the same because it sounds like you have a lot going on and that dietitians really are in every aspect of the hospital, which is great.
Absolutely.
And then also in nutrition, we have a term called MNT, which is used commonly in the inpatient setting, and that's going to be our medical nutrition therapy. But for this, do you have a favorite MNT moment?
I would say my favorite MNT moment would be, I guess, being able to see the difference that nutrition makes in your patients. So, for example, I had an oncology patient recently that spent a long time in the ICU. He had esophageal cancer. So he had a really complex GI surgery that included an esophagectomy. So he was strict NPO, so nothing by mouth for quite a while. He got all of his medicines and nutrition via a J tube, so a feeding tube in his jejunum. He spent about a month in the ICU, but by providing him with the right nutrition, we were able to minimize weight loss. We were able to give him the optimal amount of protein to preserve lean muscle mass, kept him adequately hydrated, met his vitamin and mineral RDIs. So I watched him continue to improve. I followed him all throughout ICU to the step down unit to the floor. And then he was actually eventually able to go to our inpatient rehab. So he worked up there. His swallow function improved when he was working with speech therapy. So throughout that whole course, he was eventually able to eat again. So upon discharge, he was happily eating, getting supplemental tube feeds to get him through chemo and radiation. So it's just really fulfilling, I guess, to be able to see your nutrition recommendations and your nutrition intervention play out and actually make a difference in somebody.
That's so wonderful. It really shows that you start with the patient from the beginning and really help them progress. And it is fun when we get to see those success stories. And I'm sure your patients love getting to see you throughout their time and just a nice person to talk to and a comforting face. But thanks so much. Thank you so much for your information, Lizzie. And we hope to see everybody next month on our next edition of Registered Dietitian Nutritionists in your community. Take care, everyone.
Thank y'all.